Tech Snippets Today with Joseph Raczynski.
All right, I am ecstatic to have Dr. Anmol Kapoor, MD, founder and CEO of BioAero and Enriton. How are you? How's great that you're joining us today. How are things going?
Amazing. Thank you so much for having at your show.
Oh my goodness, this is fantastic. Really looking forward to this thing. So, all right, let me set this up. My thought around this whole thing all starts off with 23andMe. Um, which has had some issues recently. The genetic testing company recently filed for bankruptcy, and all of your data could now be sold to the highest bidder. That's very possible given the current scenario. This case serves as a stark reminder. The current model of medical data storage is flawed. If consumers and healthcare institutions fail to act now, genetic data will continue to be vulnerable to corporations and security breaches as well as regulatory loopholes. Alternatively, there is a solution. Imagine a world where your genetic data is not at the mercy of corporations, but instead resides in a secure, private digital vault, accessible only with your permission. It's a world where you, not the faceless boardroom, decide who gets to see your medical history. That world is very possible, and hopefully will be the discussion points of what we're about to get into today. So, all right. Now, before we really dive into this, I'd love to hear a little bit more about your backstory and what led you to the founding of the two companies that we mentioned.
Thank you so much. So I'm a practicing cardiologist in Calgary, Canada, and I came across a situation where people were not able to get an answer. Why do they have heart disease? Why do they have heart failure? And why are not responding to the medication for the cholesterol or having some side effects? So the challenge was that my answer was always that like, I don't know, or maybe it's genetics. So, but that was not an educated answer. And being a doctor, we should try to put best in our efforts to find an answer for our patients. So that led me into genomics, microbiomics, epigenetics. I try to understand how these omic sciences can help me get some insights from my patients and the population at a wider scale. Many breast cancer patients, they are getting overdosed, developing cardiomyopathy, heart failure. Yes, we are able to save them from breast cancer, but they may be dying from heart failure. And we are serially checking every year to make sure the heart is not failing. So this approach didn't make sense to me. We're just waiting for the disease to happen, and with an ultrasound checking every year, why not have a more precise information, the genetic makeup of that woman, and then adjust the dosing so we don't have the side effect from heart failure still kill the cancer. So we don't have to kill one disease and then bring another disease in person's life. So this exchange of diseases happening. We have to stop this cycle. So that led me into founding BioAero, finding for answers, not only for myself, but also for my families, for everyone on this earth. And then I came across a situation where many people were reluctant to get their DNA sequence in Canada and in America, like especially Native Americans. I come across that people are reluctant. Why? Because they don't trust the corporations. The data can go in wrong hands. And data will be sold, not only the person's data, but the whole family. If you have a DNA for one person, you essentially could draw a conclusion about their brothers, sisters, mother, father, kids. So many conclusions can be drawn from one DNA. So you're not breaching one person's privacy, you're breaching the whole family's privacy. So it's totally different. And people say, well, privacy is my issue, and why doctors have to be worried. Well, because people are reluctant to get the tests done. People are reluctant to get medical investigations done because they lack trust. Medical system is all built on trust. So if we as a doctor become a business and not able to provide honest, unbiased answers to our patients, this trust will start to break. And then we're not able to achieve the best outcomes for our patients. We are going to cause more diseases and more infections happening globally. So the trust is very important to maintain that. I looked around, how do we maintain this trust? And this is how I came across blockchain technologies. Andreton was founded, and where I could perhaps give ownership back to people in their hands, like in Canada. The healthcare system or the laws in Canada clearly define that the owner of the data is the patient. but I'm the custodian. So as a doctor, so I have a custody of the data. I have to keep the data because we believe the patient cannot store the data. So we give it to the doctor's hand. So now, or the healthcare system's hand. So what we do is we can charge money to the patient to access their own data. So they are the owner, but we're charging money to give them an access to their own information. And then I am still keeping a copy. I don't have to tell them who's accessing their data. So the laws are flawed. So imagine it's your home, your car, and your bicycle, and but you don't have it in your home, and you have it someone else's home. Someone charges you money to get back to you, and you have a copy of their bicycle or car also there. So essentially, the same situation we have with the health data, and which is a wrong thing. I think we have to implement the law in principle, in the reality, and the blockchain technologies allows us to do that. That's what led us to found and written the layer one blockchain network.
Fantastic. My goodness. Okay, so let's talk a little about Anriton. Like, how does it work? How do people interact with it on both sides, whether you're a doctor, whether you're hosting that information, or you're an individual and you want to control that information? How does all that work?
Well, there were many layer one blockchain networks, and you can count them, hundreds of them. But the idea was, is there any network built from a data privacy perspective, data security perspective, data exchange? Most of them are not, and most. If you look at from healthcare data perspective, every third data that gets generated or gets stored globally linked with healthcare and expected to grow over 40% of data we are generating globally will be healthcare related. So we don't have systems implemented. Hacks are happening in America. The biggest hack happened in the insurance industry. So it disrupted the payment plans for the doctors, for the hospitals, and it disrupted many things. Those attacks are happening globally. The healthcare systems have a legacy-based health record system. They don't have a new languages. The MS-DOS based, some of them. Like language is 30-year-old. So now we have these healthcare systems built on 30-year-old programming languages. There are security flaws. Systems are crumbling and they're hacking. So how we could protect this data through blockchain encryption? So we found and written as a layer one blockchain, it's a Cosmos built and EVM compatible, a proof of stake consensus built platform. Idea was to bring in the cheap way of processing data through blockchain technologies and also showcase people how to use technology. People get in blockchain consumed by the cryptocurrency, like money going up, money going down, but they're forgetting that the actual technology in play. So cryptocurrency is the byproduct. You don't have to monetize it, but you cannot take away the technology strengths of that. And what the blockchain provides that it is a gives us as of today post-quantum based security systems. So if the quantum computers want to attack, it'll be difficult to attack a blockchain-based encryption versus the traditional encryption systems created globally right now from a cybersecurity perspective. So that's what led us to invest the resources in written, where we end up trying these things. So one of the trial was, let's try use an NFT. NFTs, people use it for JPEG, with the monkey pictures, banana pictures, and whatever they want to do with those pictures, I don't know. It's their choice. But I see a NFT as a proof of ownership. So today, if I'm wearing this jacket and you're wearing this jacket, how do I prove it is my jacket? Like, unless I have a receipt that shows me I carry all the time. Otherwise, I'm just wearing someone else's jacket. I might have stolen from some person. There is no proof I can prove it. So NFT, what does it? It is a proof of ownership. So a person can create a DNA-based NFT. Then what we can do is we can create a digital wallet right linked to the NFT. So NFT is the own proof of ownership. Now we link with a digital wallet, say 100 GB data, 500 GB data, 1 TB of data. Now you define that NFT and link with data. This guy is the owner, or this girl is the owner of this data. And so we made a DNA-based NFT, being this person, individual, one person whose DNA is there. And then we took 100 GB data of a DNA file, whole genome file, from like a VCF version of that file, and we put into the wallet. So, and the experiment was very successful. We took the data from DNA file, put in the digital wallet, linked with NFT, and now we proved this experiment that look, yes, the data can go there. Now the data can be linked with the health record system. So now we can start sending files from one health record system to other health record system, going all into digital wallet. So this wallet is now owned by this patient. Me as a healthcare provider, I don't have to keep a copy as long as the patient allows me an access. Then I can provide them the care. But if worst case scenario, healthcare systems want to keep a copy, let's assume the patient forgets something, but patient also has a copy. So they can decide what to do. In the case of 23andMe, many people have no copies, no raw data. They just go to the PDF report and the raw file, VCF, FASTQ are not given to them. And
Right.
that's actually are the most valuable files.
Yeah. No, I mean, what you're talking about is self-custody, which is a huge component of Web3 and this whole idea. So there's two things that have jumped out at me based on what you've said, which I really appreciate you going through all of. That was fantastic. The first is in this self-custody model, the part that has always been sort of a difficult one for people, and I've been talking about this idea, which you're executing on in 2017. The problem that people sort of were grappling with, and I want to see if and it sounds like you've figured it out, is sometimes people are like, okay, the data needs to be on the blockchain. So it's, on Ledger, or it's something that still people have sort of they haven't uploaded all those private files, even though it's encrypted, even though it's parsed out, whatever the case is, they make a reference to that. So it basically says, all right, here's the NFT. The picture may reside somewhere in a database, but the fact that I have that picture or the fact that I have that data is referred to on the blockchain. So have you gone down the road of storing all information on the blockchain, encrypted and private, whatever it is, or have you parsed it out, if that makes
Well,
sense?
we ran some experiments. It's very difficult to take a large amount of data and store on blockchain, very expensive. And yes, it's doable. But can it be scaled up to these systems? No, you cannot scale up. That's the biggest challenge. So what you can do is you can take a encryption technology instead of using OTP over the phone encryption and password. So perhaps you can use blockchain that way. So your cost will be less. And the data is getting still verified, who's accessing, who's not accessing it. So there's a little cost to it. It's faster, much more cost effective. And the data in the background could be stored in IPFS, could be stored in decentralized cloud storage systems, it could be stored in perhaps centralized systems could be created, say, big hospital system, they use the same technology to defend the data against cyber attacks. So essentially what blockchain does is the access to the data is limited through blockchain encryption, and they're not using the traditional systems. And now if you have a IPFS link in the background, when you have a other decentralized cloud-based data storages, perhaps in multiple clouds, you can create, and the data, how it goes to various clouds, no one knows it where it goes. Only the person in the front end from NFT side that is linked to his data is the person knows.
Really well stated. No, I love when you brought up IPFS, interplanetary file system, which is a huge one because it's decentralized storage, and is the direction that we all could go as a possibility in terms of just diversifying where things are stored compared to like an Amazon or a Google or a Microsoft. These are other alternative paths that people will be able to use, especially with what you're talking about today in a decentralized model where I have ownership of the data, which is the most important thing. Now, I love that you brought up this NFT idea. So let's just go a little bit further, dig a little bit further on that one. So yes, the Bored Ape Yacht Club back in 2021, or the CryptoPunks back in 2021, when it sort of peaked, was this idea that an image is worth something, and it still is, depending on which art direction you want to go in. But the technology of a non-fungible token that says that you own something, could be your car, the deed to your car, the deed to your house, or whatever these things are, can now be placed in this world. How do we bridge the gap that people think, oh, NFT, that was some goofy thing that happened in 2021, to something that is truly valuable and works as a technological layer for things like the medical industry? How do we bridge that gap for people in the world? You know what I'm saying? If that makes sense.
Exactly. So, we ran an experiment in Canada, and what we envision, and in Canada, we do have silos of the data, and the healthcare system is public most of the time. They're funded by the federal government and the provincial government, so state governments, and they're trying to say, look, the data between the provinces or say states is not moving. It's very difficult. People from Toronto to Vancouver to Calgary, the data just stays in those cities and doesn't come across. And a huge problem with the federal government who's paying the money, and at least half of it in some portion of the healthcare services to be delivered in Canada. So the experiment was, let's find new technologies where the data can be interoperable, data can move around in a secure manner within context of Canada, and it can work with the multiple health record systems, but the patient has a data ownership. So this way, the patient has at least one copy, and there could be multiple copies in various provinces, but there's one centralized copy in patient's hand. So the patient from Toronto goes to Vancouver. There's a file that moving with the patient. So we ran an experiment. So in a hypothesis way, that we have everyone has his social security number in Canada, like in America. We file taxes, so that's individual is unique to that. So same way, every individual will have a one NFT based number created as individual. They cannot sell that NFT. There's a law against that, so you can create a system against it. So in a hypothetical manner, so now this NFT is linked to you like a passport linked to you. So now it's a digital wallet under that link to it. So now you have this file, the digital wallet created, which is secured with the blockchain encryption. Now it's linked with multiple health record systems, so it doesn't matter where you go in the healthcare system. Wherever you're creating a data, wherever you're creating this footprint, the copy is also going to your wallet. So now it becomes more operatable with the systems. You can travel seamlessly. There's one copy that's in fact more concise. Because what's happening is people have a healthcare data on episodic manner. There's no longitudinal data sets. We go to hospital, we access services, and at that time we create a data. In between, we have no idea what is happening. You go to 10 hospitals, 20 hospitals, 50 hospitals along there, we have no clue unless the hospital has an access to. Within state to state, the data is lost. So exactly this problem we're looking to solve. We ran an experiment, kind of hackathon, and people love the concept. And we showed them how the technology can work as an experiment and how it can be scaled up.
Wonderful. How do we onboard millions of people? Do we just Is it the medical industry that's pushing this forward, or is it sort of privacy advocates? How do we get to the point of helping people understand, one, the importance of this, and two, taking action such that this will be a part of their daily or, their lives?
I think the discussion like this today we are happening, and is very, very important, and we should be having many of these discussions there. I'll be happy to come and speak at the stages, at the conference that need to be. I'm a doctor. In the same time, I'm a patient. It's my data too. So I want to make sure that data is protected and doesn't go in the wrong hands. It protects my family, and the culture and everything along the way. So I'm available. So, but at the same time, people have to realize that the mistakes happen with 23andMe, and many of those situations will continue to happen. So we should create a system. Yes, we may have the laws, but the laws are getting implemented. So we give the ownership in patient's hand, and we have to make it happen. That's very, very important. We have to have technologies that can make it happen. Only thing lacking is the intent. Let's make that happen at system level. To me, what I'm doing from our company side, we are launching a Web3 application called Watra. It's a mobile application exactly built on the same concept. It's approved by Apple and Google already, and we're looking to launch our beta version in May from Dubai. And the idea, you'll be able to back up your iPhone photos, your Google Photos, instead of having a Google Drive or other areas. Perhaps you could store data through blockchain encryption. Exactly the same concept I'm talking. So now you can take it privacy in a bit different way. So not only your health information, your other private information, your pictures, your documents from your phone can be accessed by unauthorized people. And this way, through blockchain encryption, you have this data secure.
Amazing. Okay. So one quick question I'm just kind of curious about before we launch into something totally different. And that is, if someone had an account with Coinbase, which is prominent in the United States and Canada and other places around the world, or Binance or something like that, if they had a wallet that currently contains cryptocurrency, maybe some NFTs, do you see that particular wallet being expandable to add these types of files? Or do you see that this would probably be a separate wallet that would contain this sort of information?
Well, the technology is similar. It can be expanded, but I would advise people not to mix those two things. Keep your
Okay.
bank account separate and keep your health data, your pictures data separate, just in case something goes wrong. You're not get screwed up, that everything is in one basket. So you have multiple baskets. As a cybersecurity perspective, that's my advice is create multiple layers of data security. And yes, it's doable on one side, but do separately. Keep your song file separately, your pictures, your legal documentation, tax documentations. Have those like silos created in the blockchain encryption. Keep your healthcare data another layer separately. You can have one place, but keep it separate. So this is no confusion. So you're going to see a doctor, not doctor speaking in your pictures. Doesn't make sense. Say a doctor speaking in your financial file doesn't make sense. You want to focus just on the healthcare data for the doctor perspective.
Wise words. Okay, let's pivot for a second. I'd love to get your take on this if you'd like to go down this path about longevity. So, for years, I'm going back almost 10 years, I would talk about this hypothetical that when I would talk to groups, I would say, hey, it's possible that your kids, if born today, could live to 125 years. And people would be like, you are crazy. There's no way that that could happen. And I was like, well, with the advancements of technology, the exponential rate of growth, it's possible. I mean, I don't know, but it's possible. As a doctor, as a cardiologist, do you see that you see that the advancements, the changes that are happening right now with AI and all these other things, do you see the change to humanity in the sense that we will be able to live longer lives going forward?
I truly believe in that. And I'm a default longevity doctor, being a cardiologist. So my job is to make people live long. So that I want to make sure their appointment with their God is delayed as long as I can delay that. So that's my job. Okay. So in the job, I want to make sure that we bring in the latest sciences and epigenetics, microbiomics, genomics, do provide insight. Yes, there are some deficiencies. The technologies are not there, and we as a company, as a BioWare, are heavily invested in this area, where we are looking into the multi-omics space. So essentially, what it is that there are multiple silos of data in a human body. So DNA is one kind of data, microbiome is other kind of data, epigenetics is other kind of data. Then you have imaging data, environmental data, and the alcohol you drink, the smoking you do, the exercise you don't do it every day. So there are many things in the type of food you eat. So all of those things comes in play. So all these silos of data and how you can bring it together to make a true digital twin picture of you, and then we can follow you longitudinally. So that's where the intersection of science is, where we are right now. It's 100% solvable. What I tell that my kids who are late teenagers, I tell them they have a higher chance of hitting 125 years of age than a person who's 50 or 60 or 70 years of age as of today. Yes, this is the people who are worried today are 50, 60, 70 because they don't want to die. So they are going in this direction. But the investment they're doing, the research they are pushing it forward because self-trying things, it's the kids who are in their late teens, early 20s, mid 20s, who will drive the most benefit from the science innovations of today. Example simple is if you take an apple fresh off the tree, put in the fridge, it can last the longest. Yes, there's a DNA inside an apple that will make it die eventually. Maybe take it 2 months, maybe 3 months. But then you take an apple that has been kept outside, wrinkly, and now has some kind of damage on it. You put in the fridge there. It's not going to last longer. So versus an apple that is left outside. So yes, there is a possibility. The earlier you start, the longer you're going to live. It's not like once you already have a disease, you already have blockage in the heart arteries, you already have some cancer there, you already have COPD, diabetes, high cholesterol, high blood pressure, and many things along the way. There's very less chance you're going to hit 100 or 100 or 25. But if you can delay the onset of diseases, at least by the 50, make sure you have no disease at all. No high cholesterol, no coronary artery calcification, no diabetes, no high blood pressure, no obesity. Then hitting 100 healthy 100 is much easier.
That Apple example is one of my favorite. I may have to borrow that. I haven't heard someone talk about that. That's a perfect illustration, and I I love it. So, one of the things that I think is fascinating is I'm a big fan of Dr. Peter Diamandis, who talks about exponential growth and abundance. And part of what you just said is the similar ideas of what he's been talking about for a little while as well. Um, One of the things I read recently was in an MIT study, or actually a newsletter. They basically put out something that there's a company that's working on essentially the cloning of the human body without the brain, so that they would take DNA from you as an individual. And so if they wanted to reclone your heart or a certain, maybe a lung or something like that, a liver, whatever the case is, it'd be much easier to replace those things. To me, it feels a little weird to think about that because you're separating the brain, the consciousness from the body and creating that to then harvest those organs for a human being to live longer. I get that that's probably the direction we're to go in, but as a society, are we okay with that vision? What do you think about that?
Well, go back 100 years when the blood transfusion was a gold standard, and people were reluctant to take someone else's blood. And there's a huge ethical dilemmas, legal dilemmas were created at that time. Come on, it's someone's blood you're putting in, you're going against doctors, sorry, against the gods and the satanic ideas. So many different things where people are discussing it. Now, most people are comfortable. Then we had pig valves came out. So many people, because of their religious beliefs, didn't want to have it done. But they were lasting longer than the mechanical valves in some situation. And in some situation, they are the best option if the person is old, cannot handle the mechanical valve. And so people got comfortable with that. So slowly by slowly, yes, there is always a religious bias or belief out there. But in the end, we know that transplant medicine happening. We are harvesting organs from other people and putting in heart, lungs, livers, kidneys. It's been happening. People accept that. No one asks that person, look, what's the religion of this person who's donating me a kidney? What's the color of this person who's donating me a kidney? We don't ask that question. And the person is not even asking. The person looking for that kidney so they can get off the dialysis and live their life normally. There's a problem. The problem is there's a shortage of those medical organs out there. I can give you one example. When COVID hit in 2000 in 2021 time, there was a shortage of those organs. And why? Because the young people were dying. So we want young people to die so that we use their organs and harvest them and put into the older people who need that. This is how the business model is working. I don't call it business model, but that's a model is working. Okay, a mid to old person, age person needs an organ, and who's going to give it? And most likely is a young person who was driving a bicycle or doing something stupid and dies. And now we are taking donation from that person's body and putting into multiple people. And in the COVID times, people were home. People were not doing the stupid things, and there were less deaths happening globally. So what did it do? There's a shortage of organs. So because shortage of organs, we couldn't transplant that many people, and the people who are waiting for the transplant, they start dying because you can only extend their lifespan waiting for the organ to come in. So there was some side effect which most people don't even talk about that. And then after the COVID restrictions are taken away, people start dying again. The shortage went down. But again, it's a wrong thing. It's unethical. We want young people to die, and the old people are waiting for the organs, and they have to live longer. Come on, doesn't make sense, right? It's a concept.
Yes.
So there's an ethical dilemma right there. But we're doing that every day. So why not create an industry where these organs are ethically being grown, and then we can harvest them and help humanity, and then we'll be able to help them live longer. So I'm all about it. All about this idea. It's a good idea. We should do it.
Wonderful. Oh my goodness, Dr. Kapoor, thank you so much for everything you've brought to the table today. Very, very helpful and enlightening.
Thank you so much for having me.
Tech Snippets Today with Joseph Raczynski.